morning. Today we're going to be working on trach care and trach suctioning for Mod 2 Fundamental 2 skills. So first what you're going to do is wash your hands and put on a clean pair of gloves. Tracheostomy patients are either going to have oxygen or they may be without oxygen depending on their status of the trach. If they have oxygen on, then that means that they're going to need those rescue breaths for suctioning, and you're going to have to remember to replace the oxygen to let the patient have supplemental oxygen throughout his or her care, okay? If we're suctioning, you want to give supplemental oxygen anyway, just because the deep suctioning is going to stop them from breathing. This is also where we told you in class to hold your breath to kind of mimic how the patient is feeling, okay? So this is what the patient will look like beforehand. So we're doing clean gloves. We're going to have our kit, which is in your kit, and this is going to be sterile, all right? So we open up the kit. You have your sterile gloves, which you can touch on the cuffs. You take your drape, and you're going to want to do your 2-inch border. So some kits, this kit comes with it with hydrogen peroxide. Other kits may not come with it, so you'll have to get hydrogen peroxide and saline from your storage cabinet. That can be not sterile, doesn't have to be sterile. You would just pour it in. So these are my sterile gloves. I'm taking by the cuff, and then I'm not going to touch anything else because the rest of the kit is sterile, okay? So now, again, you still have clean hands. Loosen this. Now there you have your ties, your dressing, your inner cannula, which is going to roll and click. So you can take your old dressing off. Note the secretions and drainage. Then what you're going to do is you're going to take your inner cannula. So what I did is I went counterclockwise and out. With this, you want to be very careful when it's coming out. Maybe even wear goggles because we don't want to whip it out. There could be a lot of secretions in here and you could get some in your eyes. So be very careful. If you want to wear goggles, that would be a really good idea. Okay, especially with suctioning. Most of these today are disposable, but if you don't have a disposable one, or if your facility is calling for reusable, then that's totally understandable. But just check with hospital protocol and facility protocol because they're usually disposable, and then you can just get a new inner cannula. If not, take the rest of our supplies, dump them out, and then we're going to use this basin as a cleaning basin. So this is saline, and this basin is going to be saline and hydrogen peroxide, 50-50 mix, and we're going to put our inner cannula in there. These are going to be saline, okay, because this is what we'll use for suctioning. Now there's no suctioning in this kit, so I'll do that on another video. But your kits are going to have the suctioning with it. So I will pause this video, restart it, and I'll show you what your kits look like. Every kit is going to be different. So make sure you know that, make sure which facility you're working at has what kits they have, so this way you know what supplies to get and take into the room. So I'm gonna soak this again with 50% hydrogen and saline, and that's gonna soak throughout. Then what I'm going to do is I'm going to switch up, and I will do, actually gonna pause the video and get the suctioning kit.